This is the Blitz 2025 perinatal loss update and review section. I wanted everybody to remember that we had forget-me-not boxes for all of our lost patients who have experienced perinatal loss less than 20 weeks. They were donated, and so we do have to keep track of them. We do have a log in the loss room to track who we give them to. We need to put the patient's sticker on there, gestational age, and the date. It has some nice little paraphernalia in there for memory making for our patients. And it can be used for anybody that has experienced loss less than 20 weeks. There are a few facts that are really important to know. Most of our losses between 0 and 10 and 6 weeks do not require any paperwork to accompany the specimens, unless the family is requesting to have the specimen returned to them. Since typically our losses between 0 and 10 and 6 weeks go down to pathology and are cremated, that's the standard procedure for that gestational age. We do have something called a purple sticker project, which is a quick and easy way for everybody to see that there is something different with this patient. So you have to request purple stickers from the clerk in the PACU, and there are some paperwork that needs to be filled out, and so the specimen will receive a purple sticker on it, and the paperwork will receive a purple sticker on it. This is a way for everybody to see that this is something different, and of course communicate to everybody involved in the care of this patient that this patient is requesting it back, so everybody's on the same page, and make sure that when it's sent down to pathology, pathology will be able to see, oh, there's a purple sticker. This is not what we're not going to just cremate this specimen. We are going to return this to the family. So that's the purple sticker project. Another fact is that when you have loss of multiples, each baby has to have its own set of paperwork, loss paperwork. Another fact that we have is there's a new medication called cabergoline, which inhibits lactation for pregnancies that are greater than 18 weeks. Not all of our providers know about this, so if you happen to be taking care of a patient with a loss in a pregnancy that's greater than 18 weeks and does not want to donate her milk or is very concerned about the lactation process, talk to the provider about cabergoline. It is the one-time dose, 1 milligram PO medication that we have to give to the patient within 24 hours of delivery. It is located, we can get it from the PACU, Pyxis. So make sure that you ask the providers about that. There is a little contraindication for it, which is hypertension. However, again, it is something that you should discuss with the provider, because it just depends on how well the hypertension is being treated, whether cabergoline is a good fit for that patient. So then we talk about the new flow sheet tracker, where you have to wrench in the perinatal loss flow sheet. When you wrench it in, on the storyboard, it also indicates that there is loss documentation on there. All of the changes that happened with the perinatal loss flow sheet has to do with maintaining a chain of custody for our fetuses. So the nurse is responsible for maintaining the chain of custody. And anytime the fetus's location changes, it needs to be documented in the flow sheet. So if the fetus is on a cuddle cot in the patient's room, you are going to document that. And when the fetus is moved to the central soil room, you are again going to document that as well. So anytime it changes, you need to document that. Anytime you put a specimen of fetus into a fridge, you need to fill out the log. All of our fridges in the central soiled room and in the OR soiled rooms have logs, and all of the specimens need to be logged in and then logged out. Like I said, the nurse is responsible for the chain of custody of the fetus until the fetus is taken down to pathology. When the paperwork is completed and the fetus is taken down to pathology and it is documented in the flow sheet, only then is the chain of custody responsibility over for the nurse. Until that time, if the paperwork is not completed and the fetus is not taken down to pathology, and it is not documented, the providers cannot write a discharge order for this patient. There is a hard stop that comes up on the patient's chart, and the provider will not be able to write a discharge order. At that time, the provider may come and find the nurse and find out what's going on, in which case, usually the reason is that the provider has not completed all the paperwork or has not communicated with the nurse that the paperwork is completed. Once the paperwork is completed, you document it in the flow sheet and take it to the clerk and have them scan it into the patient's chart. Once it is all completed and filled out in the flow sheet, there are the last two lines of the paper tracker, the paperwork tracker in the flow sheet, are the two lines that cause the hard stop to show up or not to show up. So the paperwork complete needs to be documented and the fetus needs to be transported to pathology. And those both need to be documented in the flow sheet before the hard stop goes away. And the patient can, the provider can write a discharge order for this patient. I'm going to give you a scenario, something for you to think about. If you have a baby, let's say 23-weeker that's born in the OR, parents want everything done for this baby, and it's taken to the nest and then subsequently taken to NICU. Our patient is taken back to our room to recover, and then that baby subsequently dies in the NICU. What do you do? So if the baby has passed in the NICU, it is NICU's responsibility to make sure that all the paperwork is completed. Let's say that the patient wants to see the baby at some point in time. You would communicate with the NICU that the patient wants to see the baby, and make sure that before you accept responsibility for this patient, the baby, that you have completed paperwork from NICU. NICU is responsible for documenting time of death. If you don't get completed paperwork from them, you will be trying to run around and find the provider who needs to fill out the paperwork. So just make sure that you get completed paperwork from NICU when you take responsibility of this fetus. Once NICU gives you the fetus and gives you the report and gives you the completed paperwork, begin your flow sheet tracker, because you now have responsibility for this fetus. You have to maintain the chain of custody and document the location of the remains of the fetus. NICU is no longer responsible. You are. And so until that time that the paperwork is documented complete and that fetus is taken down to pathology, you are responsible, and the hard stop will show up and the patient cannot be discharged. On the bottom of the perinatal loss review here, there's the team members of the team members of the bereavement committee. You can see there, everybody is available to answer questions to you. The Office of Decedent Affairs Liaison is Latricia Wiley. So you can ask anybody, any one of us questions. We'll be able to help you.